list. So if you want to catch up on anything or share it with somebody. Okay, let me just get my slideshow here going. All right, welcome everybody to the social prescribing presentation we have today for our Intergenerational Linkages Community of Practice. And this group is supported by the CORE Alberta Platform. So we are a national group and we work across Canada. However, we are hosted on the Alberta site because that's our historical legacy of where we began before we branched out national. And CORE Alberta is supported by Healthy Aging Alberta, but we also have the other CORE platforms supported by United Way of British Columbia and now Help Age Canada. So we welcome you to join those sites. So I'll just start us off with a land acknowledgement. So in the spirit of our journey to promote reconciliation, we'd like to honor the truth of the shared history and acknowledge the many First Nations, Métis, and Inuit who have lived in and cared for these lands for generations. We are grateful for the traditional knowledge keepers and elders who are still with us today and those who have gone before us. And I'm tuning in from Calgary, also known as Mohkinstsis, which is on Treaty 7 territories. And part of the Blackfoot Confederacy, including the Kainai, Piikani, and Siksika nations, the Tsuut'ina, and the Yahe Nakota, including the Chiniki, Bearspaw, and Goodstoney nations. I'm also tuning in from Métis regions 5 and 6. And I'd like to recognize all the nations across Turtle Island that we are representing or we're tuning in from today and those treaty territories. Just some housekeeping. Keep yourself muted while the speakers are going. We'll have open time for conversation here. And you're welcome to have your video on or off. Please drop your thoughts in the chat if you have any questions or comments or anything like that. You can also use all the different reactions or raise your hand. And as I mentioned, we will be recording this session. I will put it up on CORE Alberta afterwards, and we'll share the link with you here so that you folks have the recording if you want to share it or watch it another time. It'll also go into all 3 CORE platforms and the group space. So if you're new to knowing about CORE, we have 3 CORE platforms. So they are both provincially and nationally coordinated learning platforms, which are designed to strengthen the sector and increase organizational and sector capacity through information sharing, training, mentoring, communities practice, policy development, and resource development and collaboration. So we are hosted on the CORE Alberta platform, which is championed by Healthy Aging Alberta, and our backbone organization is United Way of Calgary and Area. However, we are a national group, and there are also CORE BC and CORE National platforms. All 3 platforms are relatively similar, but with different regional specific content. So you're welcome to join all of the platforms there. And I am representing Healthy Aging Alberta. So is my colleague Beth, who's in the room here. So we are a rich network of community-based senior serving organizations across Alberta, united by the shared vision, which is to make Alberta one of the best places in the world to grow older. So we are developing a coordinated CBSS sector that is respected, integrated within the broader system of care that can empower, support, and inspire every older Albertan to age how they choose, and ultimately improving the health and social outcomes. So by coordinating that sector together, we are creating the infrastructure that connects us to increase our collective impact. I'll introduce you to our group here. So Betty was speaking already. Betty is our group lead. She's an intergenerational trainer and consultant with Good Links Intergenerational Practice and based out of Calgary, Mohkinstsis. We also have Jane, who is the co-chair for Sundre Senior Spruce Society out of Sundre. I already introduced myself, based out of Calgary and representing Healthy Aging Alberta. And then we have Rochelle Patil, who is a social gerontologist with the Nork Innovation Center at UHN in Toronto. Now introduce our speakers for today. So we have my colleague Beth Mansell, who is our Provincial Social Prescribing Project Manager at Healthy Aging Alberta, who's going to talk to you about social prescribing. And then Anna Hutman, I'm sorry, Anna Houtman, yes, outreach worker with Innisfail Social Prescribing. So I'll pass it over to the two of you.
Awesome. Thanks so much, Steph. It's so nice to see so many people here today to learn a little bit more about social prescribing. And I'm hopeful that we can kind of draw an intergenerational link to the social prescribing work that's happening across Alberta as well. So I'm going to share my screen. We have some slides. Do. Oh. Go. Hoping that you can all see the slides and not my lovely notes that are on my other screen. So thank you everyone again for attending today. So as Steph mentioned, my name is Beth. I am really fortunate to manage all of our social prescribing programs that Healthy Aging Alberta is supporting across the province. So what is social prescribing? I'm sure most of you have heard the term over the past few years. I think it's really emerging across the country as a new way to connect the healthcare system to all of the really great community-based programs and services that exist. And social prescribing is really about formalizing that process and that approach to bridge the gap between medical and social care services. So through social prescribing, healthcare professionals can refer patients to those community-based programs to improve their health and enhance their quality of life. So I often say to people, it's not a new thing. I think social prescribing has existed in many forms for many, many years, but social prescribing is really formalizing that connection between healthcare services and those community-based programs and services as well. So, did you know that over 80% of a person's health depends on those social determinants of health, like adequate food, housing, income, and relationships with others? Social prescribing project in Ontario back in 2020 showed that 57% of patients improved their health and well-being at 3 months post-social prescription. And at the same time, there was a 40% reduction in the number of repeat clinic visits at 9 months social prescription. So coupled with these facts is the statistic that almost 100% of Canadians over 65 and older plan on supporting themselves to live safely and independently in their own home for as long as possible. So you bring all of these three things together, and we can obviously see that social prescribing is having a positive impact on health and well-being, and kind of reducing some of that strain on the healthcare system, as well as that we know that community-based programs are addressing those social determinants of health. And we also want to continue to support older Canadians to age in their own community. And so this is why Healthy Aging Alberta got involved in social prescribing. So we believe those community-based programs and services have the best local knowledge and relationships that contribute to successful implementation of social prescribing. We also see it as an opportunity to incorporate asset-based community development. So being able to leverage all of those strengths that exist within a community to kind of connect people to different programs, different groups that might exist, hopefully have them build their own capacity to maybe lead some of those groups in the future. That's really what that asset-based community development is talking about. And then the end goal is that social prescribing will enhance the sector's ability to increase resources and capacity for those programs and services. So by formalizing that approach of healthcare referring into community, we're able to track the impact that those programs are having on someone's health and well-being, and hopefully advocate for increased investment in those really important community-based programs and services. So this is a little bit of what our referral pathway looks like. So on the left side of the screen, we've got the healthcare providers, and in our work, we've really opened up to any regulated healthcare professional. So of course, you've got your typical doctors, nurse practitioners, nurses, but in some communities, they're also connecting with pharmacists or community paramedics. So anyone that an older adult is kind of coming into contact with in the healthcare system that may be picking up on those unmet social determinant of health needs can make a referral into a social prescribing program. But on this left side of the screen, we've got primary care, hospital discharge, and home care. That's where the majority of referrals come from in our programs. So those healthcare providers make a social prescription, which is in essence a referral to a link worker or an outreach worker within a social prescribing program. So that individual is employed by a community-based senior serving organization. So in some cases, it might be with FCSS, so Family and Community Support Services for those that aren't in Alberta. Or in other cases, it could be a senior center or a community-based organization that predominantly serves seniors. So that link worker or that outreach worker will meet with the client. They engage in a holistic assessment, and they work together to co-create goals and a care plan. The link worker or the outreach worker engages in regular follow-up support. So on average, they're having between maybe 6 and 12 kind of connection or touch points with the client. And then they provide regular updates back to the healthcare provider as well. So there's a nice template that many of our programs use where it says, I've referred Jane Smith and been working with her for a period of 3 months. These are some of the goals that we're working on. And then they send that back to the healthcare provider as well. And then on the right side of the screen are all of those aging and community supports that support those social determinants of health and enable someone to continue aging in community for as long as possible. So everything from meal prep and food security support, all the way through to those kind of social and recreational programs that we come to think of when we think of places like senior centers. So connecting people with the Dominoes group or the chess club or the knitting group, or connecting people to kind of aquafit programs that are in the community as well. So there's really a broad range of things that link workers and outreach workers help people get connected to in the community. Oh, I think I might have forgot to share my audio, so I'm going to stop sharing my screen and just reshare so that I can share this video with you all. It's just a good source of what's happening in Alberta. We'll try again here. Maybe Betty, just give me a nod because I can see your face if the video works. And if it doesn't work, I'll be able to see.
I don't think
Oopsies.
I would have progressed so fast, and I would have been able to do all the things that I am doing. But because of the program, I got an uplift.
Because you're stuck home and you're so used to it that you don't go out, but you don't know what you're missing when you don't, go out.
Social prescribing is a formal referral pathway. So a healthcare provider, like a doctor, a nurse, a pharmacist, they would recognize that maybe their client has some unmet social needs, and they would make a referral, a social prescription, to a community-based organization. And then that community-based organization where there's a link worker would then connect that person to all of the programs and services that exist within a community that meet their needs.
So I provide primary care to older adults, actually 60 up. Some have good natural supports, good networks, and others don't. There's various degrees of loneliness and isolation.
The important element of what we do is walking alongside them as they navigate through those resources and accessing them. Just having that connection to somebody that's willing to walk alongside them is really key to them being successful.
Christine introduced me to Karya Village Commons, and I have really been grateful that I had the space to improve my health.
Even for the initial intake, it can be 15 minutes, it can be an hour.
I usually be in the house, but now I am able to participate in learning programs, meeting people. This program will be really of great help to anybody who has been just doing alone or sitting alone in their house. Now you have time to go outside and do some exercises or do some sports activities to fulfill your or enhance your personality.
We set up an intake visit where we do an assessment that basically asks a whole bunch of questions to get a better idea of their situation. So in terms of finances, social supports, food security, housing, it really encompasses all aspects of their well-being. And then together we develop a service plan where we list goals that we're gonna work on together and in a time frame that we want to complete them by. And this is very much a collaborative approach. So it's not me just saying you need to do these things to improve your well-being. We discuss the supports they're looking for, and through the intake, I'm also able to see, are there any gaps and resources that I can suggest that I really think they could benefit from as well.
You could do crafts one day, you could do, it was endless. You know, you could do carpet bowling, birthdays once a month. Just, I can't even remember how much, but there was something for everyone. I feel like I would have had a harder time when it came to just about everything, getting my pass for the pool, getting the taxes done, getting all these little picky things done, you know? And they knew what was coming up, and they knew what to do, and they knew where to go.
I can see like that confidence that they've built, and now they're able to take initiative when problems come up. They're more aware of the resources available to them. So yeah, just seeing that has been really, really amazing.
So I hope that video kind of gives a better idea of social prescribing than maybe I'm able to just through words. I think everyone learns differently, so I love sharing those videos. I think it's just a way to share that impact a little bit more. So what's happening in Alberta? So as I mentioned, Healthy Aging Alberta is supporting social prescribing across the province. We currently fund 10 different communities directly. And over the past few months, there's been an additional few communities that have come on board that are being funded through the government of Alberta, but are still kind of brought into our network. So we started in December 2022 in Calgary, Edmonton, and Lethbridge. And then in the fall of 2023, we onboarded another 7 programs, mostly in rural communities. So Jasper, Whitecourt, Sylvan Lake, Innisfail, Red Deer County, Strathmore and Wheatland County, and then also Vulcan. So there's those 10 communities that we've been working with for the past at least 2 years now. And then we have some new communities in Medicine Hat, Grand Prairie, Fort McMurray, and also in Red Deer, the city itself since then. So there's definitely a lot of growth happening in the social prescribing space. Our work in Alberta has predominantly been focused on supporting older adults. It seems to be where there's a lot of momentum for social prescribing right now and investment in the work, and very much being driven from the community sector. So in other jurisdictions, social prescribing might be led by the healthcare sector, but in Alberta, it's very much community-based organizations that are driving this work and saying, we've heard about social prescribing, we want this in our community. How do we connect with the health system to be able to do that? In terms of our referral sources, right now, there's about 50% of referrals that are coming from home care across the province. I think there's been a lot of momentum there. 25% from primary care, and then 25% from acute care. So focusing on that kind of hospital discharge and making sure people have the supports in place when they get home from a hospital visit. There's a quote on the bottom of the screen here from a registered social worker within a primary care network. It says, I like the program because it can connect the clients with the best possible agencies to assist them, rather than me guessing what that might be and sending them to the wrong place. And so I really think that speaks to, on one of the first slides I had, why social prescribing. And one of the reasons was because I believe that those community-based organizations have that knowledge and have those relationships with other community programs that the healthcare system just doesn't have. And I think this quote really speaks to that. We know that people that work in community just have a way of finding out all these different kind of grassroots programs that exist, and they spend the time to learn about those programs, know what's happening, and it really makes those referrals a lot stronger. Another example that I always share is in one of our communities in Sylvan Lake, the link worker there drives their Zoomers bus once a week. So their Zoomers bus, it connects people to the grocery store. So she has a route, she picks up the clients and then takes them to the grocery store. And so it's really cool because I think by her being the driver of that bus, when she gets a referral from a healthcare provider and maybe someone needs support getting groceries, she's able to say to them, well, hey, I drive the Zoomers bus once a week. Like, why don't I add you to the list of people? I'll come pick you up. And then it's a friendly face for them to know what's going to happen. And then it becomes kind of a social opportunity in itself. The bus, I think it seats like 18 people or something like that. And it's then a social engagement where they're then connecting with other seniors when they're on the bus. And then for her as well, driving, she's also hearing, as she's driving, she's hearing about other kind of programs that are going on that people are going to. So then that helps her connect more clients to those programs in the future. So I just think it's just a really cool kind of different way. I don't think you often hear about someone that's doing kind of like frontline client work, but then they're also engaging in that community development and yeah, I just love that example and I tell that story all the time. So how does a healthcare provider determine if someone is a fit for social prescribing? So we often suggest there's kind of some prompting questions that they ask older adults that are coming into their practice. So how often are you seeing your friends and family? Are you having challenges getting from place to place? Are you able to access healthy foods that you like? What's your current living situation like? And do you need support accessing social services? So I'm not saying that a healthcare provider needs to ask all of those questions, but it definitely helps to prompt when someone might have some unmet kind of social needs that a link worker or an outreach worker in the social prescribing program could support with. I'm going to pass things over to Anna to talk a little bit more about the work in Innisfail.
Hello, so I'm the outreach worker in Innisfail's Social Prescribing Project. So Innisfail, they're a small town in central Alberta with seniors making up almost a quarter of their population. So a little bit of history on how social prescribing came about. Back in 2017, the Medical Clinic and Primary Care Network teamed up and created the Community Partners in Action, or CPIA, with the aim of making Innisfail a dementia-friendly community. Once Alberta Health Services had also partnered with the CPIA, they were able to hire on a recreational therapist who organized all of the dementia-friendly programs we have to date. Many of these programs in the CPIA goals have shifted to an age-friendly approach, which just opens up the inclusivity for all. And all of those programs organized by the CPIA rely on community charitable donations as well as grant funding. So in 2022, McMahon, who'd focused on youth and children at the time, also joined the CPIA. During COVID, they'd seen an increase in seniors needing support, but they didn't have the resources for them at the time. Because of the work that the CPIA had put in and the partnerships they'd created, McMahon was able to welcome the 55 plus social prescribing program. So social prescribing in Innisfail was funded through a generous anonymous donation through Healthy Aging Alberta via Calgary United Way. And since the program started accepting referrals in November of 2023, we've received over 150 referrals to date. We can go to the next slide here, Beth. So the majority of our referrals, about 78%, come from 4 main sources. The geriatric nurse who played a major role in creating the CPIA, as well as Alberta Healthcare Home Care, the hospital social worker, and then our local FCSS, who works at a town office. And majority of the adults who we serve access supports in multiple areas, with exercise and social programs being the one that was most utilized, closely followed by assistance with the financial benefits. Now that being said, lately we've had a lot more doctor referrals come in. So I think these numbers are shifting a bit, and we've had a lot more housing referrals come in. So there's a bit of a shift happening in the last few months with where needs are coming from and needing. But being such a small community, both new and old residents have been feeling intimidated going into events they haven't been to in the past. We kind of joke that it's like being back in high school where you need to find your place in each group. We can go to the next slide here, Beth. So we get feedback from clients and the community professionals at every 6 months. So it's called our outcome measures. The clients, at this time, we'd only collected 10 assessments from 10 clients, but over 80% of those perceive themselves to feel more content with the connections after being involved with the program for 6 months. And just daily, we receive just verbal feedback from our clients and community professionals. Many of the clients state that they don't know what they're going to do if this program isn't continued past the 2-year pilot. Community professionals, they find it really beneficial that we're able to go right into the home, build that one-on-one relationship. We're fortunate we can drive clients so that if they need that doctor's appointment and they need the advocacy, we'll walk right into the doctor with them, drive them there if transportation's a barrier, make sure they get the supports they need, they're being heard, that advocacy is happening. So, and then families as well, we receive lots of feedback from families, just how happy they are. Maybe it's their mom, their kids are busy working, and they can just see that mom is busy now. She's out and about, she has those connections. So lots of great feedback has been happening. We'll go to the next slide here. So the CPIA has organized the community kitchen, which has been a huge hit with both social prescribing and just in the community in general. So it's held many times a year. It depends on funding. It comes in as those community donations again. So originally it had space for 10 individuals to gather and cook a meal together with a registered dietitian free of charge. After a lot of interest, they increased it to 12 participants, and many of those participants had stated that they would pay for the service. They just had such a good time. So there is now a $5 charge, but if that's an issue, there is the fee assistance program in Innisfail, which is an excellent resource. So at this community kitchen, everyone prepares a meal together. So there's generally 5 recipes: the meat, the carb or side, the vegetables, as well as a dessert, and then usually muffins or some sort of breakfast item. Each recipe is almost a station, and then it's 2 to 4 individuals that work together. Everyone does what they're able to do, contributes what they can contribute. A lot of our social prescribing individuals live with some sort of limitation. So we've had people with vision loss attending, mobility challenges. Some people don't have full function of their hands. The beautiful thing about this kitchen is everyone works together. You do what you can, they help each other out. The one with vision loss, they can do all the stirring, pouring, all of that. Someone else will measure. Many younger individuals in the community join as well, and then they can do the more complicated recipes, do the more physically demanding things like a lot of the chopping, or if we're doing potatoes, mashing. It really is excellent. Once all of the recipes are prepared, everyone sits together and we eat the meal together as a group. While they eat, the dietitian will educate on the nutritional facts of either the recipe, or she'll have packaged food and bring that along. And we just go through how much fiber is in this item. Now, that being said, there's generally a theme to each cooking class. So I believe one of them was cooking for one. So then we talked, how can you make this meal into a meal for one? Or how can you make it stretch on a budget? That budget one was excellent because then everyone shared resources that they had. There's the flash food apps. There's, well, the food bank in town. Everyone's kind of shared their own knowledge on how to make the dollar really stretch. And then at the end of the meal, everyone splits up the leftovers, and there's usually 2 to 3 meals each that get sent home as leftovers. So it's a bit of food security piece as well. And then everyone can share their culture experiences. It really is excellent. We made pierogies once, so we had a couple Ukrainian individuals and telling them how their mom had made their pierogies. And it's neat. It brings people of all ages together. Everyone gets to contribute. And then, everyone has nutritional food that day and a few days after. So we always get demand for that one. And we have a few people who are in the social prescribing project, but just for the community kitchen. So we hope to see more of that soon.
Awesome. Thanks, Anna. I'm sure lots of people have questions after about some of the work that's happening in Innisfail. So I wanted to touch on some of the outcomes that we're looking at with the social prescribing program. And we will have a more in-depth webinar next week on our year 2 outcomes. So I didn't want to spoil too much today. I wanted to give some people a incentive to attend our webinar next Tuesday. So I will put a link in the chat for that webinar as well. But what we're seeing is kind of those client level outcomes, as Anna touched on, kind of that connection piece has been really, really big across the programs. We're also seeing people report that their physical and mental health improves through participating in the social prescribing program. People have increased confidence to live at home, and that reduced isolation and loneliness. And then at more of a system level, we're also seeing reduced length and frequency of hospital stays and emergency room visits. And just at that community level as well, the increased community connections and natural support networks that are growing. One of our goals at HAA is to continue to increase the scope of social prescribing through community development. So as I mentioned, we're only funding 10 communities right now. That's just all that our funding allows us to do. But we've been working with many communities to try and build their capacity so that they could be ready for social prescribing should additional funding become available, or should they be able to source funding through other sources as well, like the municipality or through their primary care network. So to that end, we developed what we've called a community implementation toolkit. And it includes like a readiness assessment and an implementation plan that communities can do to kind of assess where they're currently at and what things they would need to kind of improve on and put in place should they want to bring social prescribing to their community. So there's 4 steps to the toolkit. The first is establishing a planning and assessment team. So that's a core group of stakeholders that are really interested in social prescribing and are kind of committed to working through this toolkit. The second step being to enhance the community's understanding of social prescribing. So as I said before, I often get told, well, we've been doing this for years. And I'm always like, yeah, of course you have been, but it's not formalized. And so I think when we think of social prescribing as a whole, we really need to increase the community's understanding of social prescribing being that formalized process. And there's additional things that you would want to put in place to have a very successful social prescribing program that enhances maybe the work that you've already been doing. And so I think that's a really important part before people say, we want funding for a link worker or we want funding for an outreach worker in a social prescribing program. Really need to really deepen the community's understanding of what that means. The third piece is that community assessment. really encourages people to look at the current state of their partnerships, the current state of their referral processes, the kind of the trust and buy-in with healthcare providers, all of those different things. And then once they've completed the community assessment and things are looking good and they've kind of got that green check mark, it also includes an implementation work plan that people can work through with the different stakeholders in their community as well. So the toolkit can be used as more of that self-assessment tool to consider where you're currently at and what you would need to do to implement successful and sustainable social prescribing program. So thinking about things like, what do your current referral pathways look like between health and community services? Is there leadership support for this across sectors? What similar roles already exist that support people in a similar way to a link worker? And has there been any asset mapping of programs and services done that that someone like a link worker could use to connect people into? We also provide resources for community-based organizations, healthcare providers, and other partners so that they could feel confident to introduce social prescribing into their community as well. And we also provide support as well. So in terms of like connecting people with other communities that might be willing to share their knowledge, mentorship through our regional community developers as well. So there's lots of, I think, opportunities that Healthy Aging Alberta can provide to communities that are interested. And so on this slide, I just wanted to kind of wrap things up a little bit by talking about some of the key ingredients I think that we see for impactful outcomes in social prescribing programs. The first one being that you really have to have a willing coalition or a group of stakeholders from across sectors, so from within community and within healthcare, that have built trust and respect for each other's role in supporting community health and well-being. The second being that strong understanding amongst those stakeholders of what social prescribing is and what the goal of it is in the community. The third is champions within the healthcare system that will promote this referral pathway to peers. I think we, across our different communities, in some communities, we have really, really strong healthcare champions that are like, yes, social prescribing is having such a great impact on my clients. I want to keep referring more and more. And then in other communities, it's been more of a trickle where maybe we'll do a presentation to healthcare and then the referrals kind of tick up a little bit and then they drop off because the healthcare providers aren't as engaged and they're not championing that within their clinics or within their teams. And then the last piece is the well-resourced and documented, so some sort of asset mapped programs and services that are available for the link worker or the outreach worker to refer into. I think this is a really important part of that community development side of things as well. And so through Healthy Aging Alberta, our kind of networked approach to social prescribing, I think there's three key benefits to that. So we have a coordinated data collection approach and a coordinated evaluation framework. So all of the communities share their client level data with us, and we feed that up into our provincial framework. So we're able to assess the impact on a provincial level, not just on a community by community level. We also host a bi-monthly community of practice for everyone that's involved in social prescribing programs. And this has been one of the strongest elements of our network as well. People really, really, really appreciate the value of the community of practice and just being able to connect with other folks across the province that are doing this work as well. It's kind of troubleshoot different challenges that they might be experiencing, but also to share their successes about what's going really, really well. And what we've heard, especially in the communities where there's maybe only one link worker, is that it's really valuable to be able to connect with a link worker in a different community as well, to feel like they're part of that broader team and they're contributing to this broader impact as well. And then the third piece is that through our regional community developers that work on the ground, I think we have more of a trusted role in community, and people can really see themselves in this work as well. Of course, there's some challenges that come with it as well. I think everyone's still learning, and we're very much taking a developmental approach to our social social prescribing work where we're willing to kind of change things on the fly. If something's not working well, we kind of take that feedback from the community of practice and from the staff that are working in those communities, and we try and adapt things and change things as we go. But yeah, over the past, I guess, 2.5 years that we've been working in this space, I think the growth has been immense. Like we've seen so much progress in terms of the amount of clients that are being served and the level of support that we're providing. So it's been a really, really exciting program so far. And that was it for my slides. And I think we're way under our time. So we have lots of time for Q&A, which is good because hopefully people have lots of exciting questions to ask us. Our emails are here if connecting via email is something that's of interest to you. And I will also put that link in the chat for our webinar next week, where we'll go a little bit more into our outcomes, and we'll have 4 different panelists. We have 2 link workers. So our link worker from Vulcan and a link worker from Red Deer County are participating. And then we also have 2 healthcare providers that are sharing some of their experiences with social prescribing over the past 2 years as well. So should be a really good event. And I will end things there. Thank you all so much for listening to us talk for the past 30 or so minutes. And hopefully people have some really great questions.
Thank you so much, Beth and Anna. This was excellent. We already have a question in the chat, which is great. And Zariva asks, does the social prescribing program include intergenerational activities?
I would say yes. So we did have just our library here in Innisfail. They tried to start up a talk with teens where they'd get some seniors coming into the library and then teens wanting to get some volunteer work. Now, unfortunately, I think they only got 1 teen, and then that fell at the same time as dinner time at our independent lodge. So a lot of the individuals who were interested, it just didn't take off. We're hoping to try and get that going again, just to get teens and then the seniors connected again. But yeah, the community kitchen, we see a lot of people in their 30s, 40s joining that, and then also our seniors. So there is a bit of intergenerational there as well. But there's definitely a lot of opportunity for that intergenerational work with social prescribing. So
thank you.
And the other thing that I would add is that a lot of the communities that we work in have really strong men's sheds as well. And I know men's sheds have a really strong intergenerational component too. So it's just about getting people connected to those different programs and services that exist. And as you all know, there's so many intergenerational programs that we have in the cities and our rural communities as well. So as long as the link worker knows about those programs, then absolutely they're getting people connected to them.
Awesome. Thank you so much. I might just have a little comment, food for thought. Just thinking about that comment that you just made, Beth, about like, if the linkage worker knows about certain things, how, like, is that something that is a gap? That how do we get all the things that are going on to the linkage worker, and make sure that they are fully aware of the community programs and services, because they're forever changing, right?
Yeah. A big part of their role is to make sure that they're staying connected to different community-based programs and services. So when we first started the work in those 7 rural communities, we did asset mapping with community stakeholders. And so we did a day-long workshop where we kind of went through a process where we kind of categorized those different assets that existed within the community into our healthy aging framework. So the 7 determinants of healthy aging. So we had kind of assets that support physical health, assets that support mental health, and so on. And so those are resources that exist in the community. But like you said, Rochelle, those are ever changing. I think there's as soon as you make a resource list, the next day it could be outdated, right? So
Exactly.
I always say that resource lists are only as good as the person that's managing them. And for those link worker roles, like that's a big part of their job is to know what's going on. And I think they do that in many, many different ways. And in some instances, it's connecting with clients that they already know, to be like, hey, did you go to that Aquasize class? Like, how was it? Is there a wait list? And so on. Or are there other things that you know of that are happening in the community? So it's really a big part of their role is to make sure that they're kind of staying up to date with that and connecting with others in the community, other professionals in the community that are aware of those things. And again, I think that's a big part of why this work needs to sit within community-based organizations and not the healthcare system, because I think healthcare workers have a much harder time knowing what's happening in community. They're just not part of that informal network or that informal kind of, I guess, community of practice that kind of exists in the community, where we're connecting with each other. We know the things that are working well for clients, and we know the programs that maybe aren't as good of a fit.
Thanks so much. We have another question from Rebecca in the chat saying, who funds the Link Worker?
So through our funding at Healthy Aging Alberta, we received a grant from, it's called Walton's Trust. They work across the country. They've been investing in a lot of social prescribing work in different provinces. So that's how we've been able to fund the link workers and the outreach workers through our programs. But their hope and their goal is that this work gets picked up by public sector funding. So whether that's through the health system or the provincial government, I think we will see that start to shift over the next few years as this work continues to grow. But ideally, the link worker positions are being funded by some sort of healthcare system funding.
Awesome. Thanks, Beth. Steph, you got a question?
Yeah, on that same theme. Beth, do you know who, because we do have some national folks here and a lot of folks from BC, do you know by chance who the funders for the BC Social Prescribing Program or CISP, the National Social Prescribing Program, are by any chance?
So in BC, the health system has invested a lot of money into social prescribing. So in BC, it's I believe it's all being funded through the Ministry of Health there.
Awesome. And then we have another question from Seviera. Could we have a copy of the template used for the assessment? Is that something that's on the website?
So each community would have their own assessment process that they're using. So I mean, if Anna is comfortable sharing the assessment that they use, can definitely do that. We have our data collection guide, which informs the assessment templates that people are using. But from like more of that community development approach, we really want each of those programs to be kind of having that flexibility to develop their own assessment processes that work for them.
I'm just popping my email into the chat, so anyone interested can just send me an email and I'll attach that.
Awesome. I really think that that's the most unique bit from what I've learned today, is like how it's so much tied to the community. And like you're saying, Beth, like that's the core, that's the heart of everything. And the truth is, like, those in community do know what's going on, and they are connected with the residents of the community in a very social way. And the fact that it's built upon in that way instead of from primary care specifically or healthcare, I think is a huge asset. And so as the assessments are built in that way, I think that makes total sense. I think that's brilliant. Thank you so much. I think we just have one more comment in the chat from Rebecca about sharing the contact for the Zoomers bus drivers link worker. I'm not too sure. Yeah, we're able to do that.
I can connect you with the folks in Sylvan Lake if you're wanting to kind of learn more about the work that they're doing there.
Cool. Thank you so much. Betty has a question. Oh, you're on mute.
Beth, if you want to send me that contact information, I'll be sending out a follow-up email tomorrow and I can include that. Do you want to do that? Okay. So now I have a question. Beth, you were saying usually it's the link worker or the outreach worker it's their kind of responsibility to find out what programs are available. But I have a few intergenerational clubs in Calgary where we could plug in some older adults if that outreach worker knew about me. So how do I get myself known out there?
Yeah, that's a great question. And I think it's all part of that community development approach too, of making sure that as programs in the community, you're aware of other programs that exist too, right? So connecting with the social prescribing group in Calgary, I think would be a great thing for you to do, Betty. Just be like, hey, this is the work that I'm running. If any of your clients are a fit for this, and just building those relationships and those connections. So I can, I think actually Steph would probably have the link to this quicker than I would. On one of our core pages is a link to all of the contact information for each community. So if you have programs in those communities, like definitely reach out to we call them the network coordinators, to kind of make sure that they're aware of different things that are happening in those areas too.
Good point. Thank you. I'm going to go and check them out.
Awesome. Maybe we can shift gears and talk about any stories that people have or any experiences that they have with social prescribing that might have a little bit of an intergenerational approach to it. But maybe before we jump into that, I just had a quick thought. I wonder if like people who are link workers or outreach workers are typically on the younger side, and then maybe that's an intergenerational like approach in and of itself as well. Like that's just a thought. I was wondering if that's kind of what the demographics look like right now anyway, in the support and then receiving support.
Depends, honestly. Like in some of our communities, the link workers happen to be maybe younger in their career, and in other communities, they're maybe at the end of their career. And I think that's what's so great about that link worker role. Like it really is kind of that. It's looking at someone who's very passionate about the work, is a natural connector in the community. And maybe they have a diverse kind of career experience and they're thinking like, this is what I really want to be doing now. And we've tried to make that role so that it doesn't require any sort of like professional credential. Like you don't have to be a social worker. You don't have to kind of have that kind of professional experience, but it's really about finding the person that's the right fit, that does have like that deep passion for working with older adults, and getting them connected to different things in the community. So I don't know, Anna, if you have any more thoughts about your experience in the role as a whole.
I totally agree. Like I had a healthcare background before getting this thing. So I totally agree. I was passionate about the older adults. And that's, I think, the big piece is being passionate about getting them connected to the resources and yeah, helping them age well, really. So.
Awesome. Thanks. Well, we can open the floor to anyone who wants to share about their own experiences or wants to maybe share some thoughts they have about moving forward in their community, maybe taking this approach or this lens to intergenerational work with a social prescribing lens. Yeah, Jane?
So one of the things that I'm doing in our community, I learned it on one of our sessions on our intergenerational site, is intergenerational dinners. So I'm just taking it a little bit further and inviting people that I know are contacts from other programs about senior socializing, and inviting our leadership clubs and church youth and things like, and families and that, to kind of a group dinner where they'll be doing activities and getting to know each other a little bit better. And hopefully those things will carry on, that we do things like that each month of the year, getting more and more people involved in them.
Awesome, Jane. Sounds super exciting.
Yeah, Betty? Also, like social prescribing and getting the healthcare providers and the outreach workers involved is more of a formal approach. And I'm thinking for all of us, we all live lives, and we probably all know people who are older or younger than us. And so we could even, without having that prescription, we could probably do it more informally in our own personal lives as well. Because everybody benefits, right?
Absolutely. Oh, I think Rebecca's hand was
Hi.
up.
Yeah,
Oh.
it was, and then I hit the wrong button. Betty, I love that thought, and I think that's, it's funny how our society maybe needs this formal push to really make it real that families matter and communities matter and intergenerational action matters, and that, oh, it's actually fun and really rewarding and has all these benefits to it. So yeah, I sure hope we can keep encouraging our society to move towards that. I have an example of a fun intergenerational program where we got a grant through the New Horizons federal funding, and it was going to dances once a month. So kind of like the Zoomers bus, we had a bus, and it was seniors and these youth, actually quite young, like grade 7, grade 8. And oh, they loved it. It was just so fun to go and be kind of old-timey dancing, waltzing and all that. So just conserving a bit of a historical way of dancing perhaps, and then the conversations, like you say, that happen on the bus were so lovely, and the kids just amazed at what the seniors could do dancing, and they felt so out of their skin, like, I don't know how to dance like this. So anyways, it was just, you could see so much learning, so many biases breaking down and relationships building, and yeah, you just want it to be able to continue and be there ongoing, and that's another problem or something we have to work on. Thank you.
That's awesome. Thanks so much for sharing that, Rebecca. I think it makes me reflect and think of how important it is to just know our neighbors and know people in our community and just connect. And it doesn't matter about your age, it matters on your interests and where we can resonate. And dancing is a great one, and food is a great one, like Anna was mentioning in that program, that community kitchen program. And makes me think of music and nature, all these really real experiences that people resonate with and love despite age. Well, it doesn't look like there's any more questions or experiences that people are sharing as of yet. I might pass it over to Jane to continue the conversation, and we can kind of see where it goes.
Okay, I'm just going to take off from one of the things that our small group did here in Sundre is we called all of there's healthcare professionals, there's community organizations, anything that I could think of that involved the community and how social prescribing can work in a small community of about 2,700 people. And we got out over 27 of the groups in our area, and they want to continue moving this forward. So the PC, like healthcare, PCNs, mental health people, everybody seemed to be involved and on board. And they even come up with ideas for us to get our messages out there. And everybody is, like they say, send your events to us, send this to us, until we get a link worker or something that we're able to work with to get those. But we also have a hub in Sundre, which is Greenwood Neighborhood Place, which our seniors already go to get financial help and things like that. So it works like some of the stuff in Innisfail already. So without funding, we can kind of start the job, and we're at the point where we're looking for a link worker. So just wondering how other people maybe have things in their community that they're actually doing already without a link worker that other people may be able to benefit from.
So this is unrelated to Innisfail actually, but I live in Olds and they have their community connection center, which I've connected with a number of times because we sometimes have people that access services there, but it seems very similar to, they hold events there. They do a lot of the same encouragement as social prescribing. So I always thought that's neat, and that's right in my hometown. So it's quite similar, it sounds, to Sundre as well. So
Thank you. Anyone else have something that they could see that seniors have access to it now, that a intergenerational program could probably be established so it's sustainable in working with the seniors in the community? Grandpals. You want to explain that one a little bit, Darcel?
Hi there, can you hear me?
Yep.
Okay. So before this position, I worked with the community senior center here in Cranbrook, BC, and we hosted meetings, Wednesdays, seniors meeting seniors. And with that, we organized with an agency called Grandpals. And what that is where seniors volunteer to go into elementary school with a classroom with one teacher. And it's usually around like grade 4 or 5. And there's activities each interaction, and it's talking about, one day it could be about how they were when they grew up, how many siblings they have, and just blending the older with the new and how things were. And we create relationship and friendships. And then at the end of the program, money from Grandpals, was donated to the teacher for resources in the school for her classroom. And it's a pretty neat program, and I can try and find the link to add it to if you guys are interested, but it was a great way to get the students and the seniors in the community. They really looked forward to it. It was a great success.
That sounds really good. I see another Carrie was from Saskatchewan, was just letting us know about an iGen program that she's a lead teacher of. Do you have any more information on the iGen program, Carrie?
Hi everybody. I'm very sorry. I didn't apply the time change properly, is basically what happened this morning. I was ready to go, but I forgot that the change happened and should have come at 10:30. So I really apologize for coming at the end, but I'm glad I'm here. So in Saskatoon here, we have a grade 6 classroom who does a shared site intergenerational program for the full school year. And it's been running for 11 years, and it's called iGen. And I'm the lead teacher and founder of the program. And so what it looks like is every day for the 10 months of the school year, our students are at Sherbrooke in the building, working with, interacting with, making friendships with, connecting with the elders that live there and receive services there. So all of these beautiful activities that many of you are sharing just in the few minutes I've been here are all kind of near and dear to my heart, because we every day get to take part in and lead a lot of different kinds of activities with the elders. We do all of our grade 6 curricular learning, mostly at Sherbrooke. We do go over to our affiliated school, which is a 5-minute walk away later in the afternoon every day. But we start our day at 9 o'clock at Sherbrooke, and we share our learning with the elders that live there. They can come and join us if they choose, even for math class or whatever they choose. But we're also part of the global community activities at Sherbrooke too. And we do small group clubs, we call them, from Monday to Thursday at 10:30 in the morning in different places and spaces around Sherbrooke. So we have an art club. We go and work with the day program on different games like trivia and just different like conversation style games. We do movement type games with the elders on one of the floors. what else do we do? We work with elders in Veterans Village who love to play cards, and the kids go in and play cards. But in addition to that, whatever we're doing in our class, such as a science fair or learning about something in social studies, that's also integrated into the community. So we're, the learning leaders of our own grade 6 learning, which we then share with elders. And I think one of the most beautiful things this year, which has kind of developed since we've, invested 11 years in the community, is that elders who are living in the community and used to work in different sectors, so elders that were teachers or elders that were whatever they were doing in other part of their life, have come in and offered to lead and teach things to our students. And that's a really beautiful thing to be a part of, because it brings a lot of meaning to the people that have, experienced big changes in their reality, their day-to-day reality, being able to come in and teach the students. So we have an elder who's new to Sherbrooke, who was a grade 10 and 11 and 12 science teacher, who has taken on collaborating with me around the science program this year. So we built planes, we had a Jube Cup, which he kind of headed up, and the kids did a contest to see whose planes could fly the farthest, and he was part of that planning of that event. We did a whole circuitry unit where he brought ideas for hands-on activities, and then he was part of helping the kids make those activities happen. So that the reciprocal part, I think, is really important in the work that we do, that we are not just at Sherbrooke to serve, which we do help with lots of things. We help portering elders to events, and we offer companionship and help out with different things, but also to offer opportunities for reciprocity. So what can the elders bring to us? Really just having our ears and eyes open for people who are looking for opportunities to share certain things that they like to do and would like to, bring that to the class. That's been a really big part of our program. And I think that's what sets it aside from other types of things that are happening, is because we're there all the time. We have the opportunity to get to know and be curious about what people have to offer, and then make time and space for that sharing to occur. So if anybody has questions about iGen, or ever wants to reach out to me, I'll just put my email in the chat. And I came because I was really interested in the idea of social prescribing, as our class can be kind of part of a prescription. We have an elder at Sherbrooke who came in a couple of years ago really unexpectedly, and he wandered into our classroom on the very first day that he arrived at Sherbrooke, and has been a really integral part of our class ever since. And I think if I were to ask him, what is one of the things that has helped you find meaning in your day-to-day life, he would say being able to come and be part of the class.
Yeah.
So we're part of the prescription. The other thing that I have noticed is we have elders who come and interact with us who are looking for opportunities to help the students. We had a student, sadly, this year who was diagnosed with a really serious illness. And that elder really wanted to help this particular student, wanted to offer a little bit of financial donation toward the student, and has been checking on the student every day, and organized a table to be set up in our building where we could collect, silver collection and messages and notes. Like, he started all of that. So again, for him, being part of a kid's class and being able to care for kids within the class would be part of the prescription for his well-being from day to day. So I just wanted to mention that those are the reasons why I was particularly interested in this topic and really wanted to know more about it. So I'm glad to hear that there's a recording of the Zoom, so that I can go back and watch and learn a little more about what other people are doing. And get some ideas for maybe how to help him along a little bit more as well.
Thank you very much. It's a big project. Does anybody else have anything from their communities? If not, I think Betty has something that the group that she works with in Calgary, as well as her own, because I know I rely on Betty for intergenerational because of all of her experience. And I know that she's available for workshops, and that's from my own side of things to get that message out there as well. So I think what I'll do then, since any other questions? Can't see anybody, unless somebody else can. If not, I think I'll turn it over to Betty.
Thanks, Jane. I was distracted. I'm just, excuse me. I'm just reading Ling's comment. She's a parent volunteer from Plant Youth Calgary, focusing on Thorncliffe, Huntington Hills area in Calgary. Plant Youth and Trellis will initiate a community art project through intergenerational collaboration. Oh, we're almost running out of time here. But Ling, can I give you 60 seconds to tell us a little bit about that art project? Because it sounds amazing.
Yeah, my name is Ling. I'm the parent from Plant Youth. Plant Youth Calgary is focused on mental health on youth. So actually it's under United Way as well. So in our community in Huntington Hills and the Thorncliffe area in Calgary, so Plant Youth will collaborate with the Trellis. Trellis is another nonprofit focused on youth as well. So we're going to plan or initiate a community art project, doing a mural. So through intergenerational, with others, with youth in the community as well. Yeah. Thank you.
Wow. Wow, Ling, that sounds amazing. You've got my email. If you, want to talk about it or need some help with that, I'm available to support you with that. When I worked for Linkages, we did a mural in Montgomery. I don't know if you remember that, but I just drove by it the other day and it reminded me of this beautiful mural on the wall that was produced intergenerationally.
Yeah,
okay.
I think I saw that mural before. Yeah, sounds good. Happy connecting. Thanks for having me. Thank you.
Okay, so quick question. Did any of you have an aha moment? Okay, second question. I'm glad you don't all answer at once. Second question. What did you learn today? Did you learn something? Was there anything that stood out for you?
I have learned.
Yeah, go ahead.
I've always seen like social prescribing, or from what I've heard, is like held within the medical world or lens. And so for me, like Beth going through this in detail and sharing today, and Anna about that this is not necessarily always the case, was a huge aha moment for me, because I realized what I do is actually very close to this. Like I'm a community connector within NORCS. So I work in people's homes or apartments, high rises, where there's just a large amount of older adults, but it's intergenerational in nature. And I didn't necessarily think that my healthcare navigation and social navigation was actually like very closely knit to social prescribing, when it in fact is. So it was just a big aha moment for me when reflecting on my role. Yeah, and just how this model doesn't need to be one way. There's many different approaches that are underway, which is very exciting.
Awesome. There's a couple in the chat. I learned about a great resource. Thank you so much for sharing. And for all of you, just tomorrow, I'll be sending out an email and I'll include the links to all these resources. And then Carrie shared my aha moment in the short time I've been here is that there's so much going on in so many communities. It's amazing to hear about the widespread interest in intergenerational projects. So we are an intergenerational community of practice, which means we are all interested in or already doing intergenerational work, which just by the nature of it, including older adults, it has that social prescribing lens to it. And so be proud of yourself for what you're doing. So what I'm going to do now, I'm going to ask Steph to put a link in the chat box because we need your feedback, because we're always looking to see what are we doing that's really working and how could we improve this community of practice and what other topics are you interested in. So I'm going to give you, it's just a short survey, 4 minutes. So I'd like everybody to click on that link that Stephanie just put in there. I'm going to just pause for a few minutes, and when you're all done, we're going to come back and I'm going to tell you about our next event and what other opportunities you've got. Okay, so go.
And if any of you have questions about the other links in the chat too, I know some folks said they wanted more resources on social prescribing. So we do have that group on CORE Alberta that's an open group. Anybody can join, no matter where you're from in the country. And there's constant resources shared there of other stories that folks are doing, or toolkits or reports or all those types of things.